I personally prefer the ART method because it's worked for me and it's a much quicker method.
What about things like, I guess the scenario that comes to mind is when in the past, when we'd worked together, there was one movement that you had me do, and it was taking massage gun to my hip flexor and then bending back like I'm in a Romanian deadlift, and then pressing forward with my hip with the gun still there. So, in I guess in those kind of movements, what is that trying to achieve?
So essentially, that's what we call active release technique or ART. Basically, what it does, it creates a fixed point on the muscle, which is where the gun is. And as you move around, that fixed point is still pressuring into that one specific spot. As you bend and extend, you are lengthening and shortening that muscle, essentially stretching it out like a cord. So it's allowing it to have more elasticity and freeing up the mobility of that muscle. Also, decreasing what we call neural tension. So if you have any like nerve buildup or muscle buildup in trigger points, you can release those trigger points by finding a spot that's really tender and moving around it to break up that adhesion on the